This is Southwest Health Talk, the podcast series from Inland Valley and Rancho Springs Medical Centers. Here's Melanie Cole.
Being seriously overweight can lead to life-threatening medical conditions such as severe diabetes, high blood pressure, sleep apnea, and more. When combined with a comprehensive treatment plan, bariatric surgery may often act as an effective tool to provide you with long-term weight loss and help you increase your quality of life. My guest today is Dr. David Saw. He's the medical director of bariatric weight loss at Southwest Healthcare System. Welcome to the show, Dr. Saw. Who should consider bariatric surgery, and are there certain parameters to consider bariatrics? Who can qualify?
Hello, yes, thank you for having me on. Basically, there are certain criteria that are set aside by national entities, such as American College of Surgeons, that determine patients who have BMI or body mass index, which is calculated by your weight over your height, kilogram over meter square. If it's over BMI of 40, then individuals considered to be morbidly obese. And those individuals who then can undergo different evaluations to see if they qualify for surgery, or patients who have diabetes, high blood pressure, severe sleep apnea, or severe reflux disease can have BMI over 35 and be a candidate for surgery.
So if somebody is determined to have that BMI and they're a candidate for surgery, what then are the steps that they would consider taking before they can actually have the surgery? Is there psychological counseling involved? What would you like them to know about what they should do?
Yes, I think it's important that individuals consult their primary doctors first to determine whether they would be a good candidate for this type of surgical procedure. And before considering surgery, they should certainly try other methods of weight loss, certainly diet, exercise, and even some medications can be effective. If these do fail, then consulting with their primary doctors, then they would ask for a referral or find a qualified bariatric program and inquire about possible surgical options. Now, once patients are introduced into the program, then we have patients go through a variety of evaluation, including psychological evaluation. There are many steps in terms of nutritional counseling and nutritional classes that patients also must attend. Patients may need to demonstrate some weight loss prior to being a candidate for surgery. Certainly, they may undergo medical evaluations to make sure that their hearts and their lungs and there are no other medical issues that actually preclude them from having surgery.
Does insurance typically cover bariatric surgery, or are there certain requirements?
Insurance, all insurances, including PPO and HMOs and Medicare, do cover bariatric surgery. However, different insurances have different requirements before patients can be a candidate. Certain insurances require nutritional counseling for a certain period of time. Sometimes it can be 3 months. Sometimes it can be 6 months. They also require psychological evaluation. They also require different insurances have different criteria that may vary from the national standards.
So then let's speak about the types of bariatric surgery that you perform at Southwest Healthcare System and start with the bypass, the gastric bypass. Please explain a little bit about what this procedure is and give the listeners just a little walkthrough about what they can expect.
Gastric bypass is a procedure that has been around for quite a long time. It's been around since the 60s, late 60s, and the procedure involves separating the upper 20% from the rest of the 80% of the stomach, and then rearranging the small intestine so that the upper part of the separated stomach empties directly into the small intestine, thus bypassing the majority of the stomach itself. So this certainly limits the amount of food that patient can intake. It also helps them control their appetite because of the separation of the majority of the stomach, reducing the appetite hormone ghrelin. This surgery is effective in achieving weight loss by small portion, as well as there is a small part of malabsorption of calories that helps them lose weight. The surgery, again, has been around for a long time and has a good track record and performed in a competent hands. The surgery is very safe. It has been shown to be very effective in treating diseases such as diabetes, aside from achieving weight loss. So in patients who are severely diabetic, who are on multiple medications, can actually achieve great benefit, sometimes achieving what we call permanent remission from diabetes. So there are some concerns in the long term, which may involve ulcers that can form. And so the patients who undergo gastric bypass, our precautions are not to ever smoke or take any aspirin, Motrin type of medications.
And what about the gastric sleeve? What's the difference? You mentioned malabsorption, so gastric bypass creates that pouch, and the gastric sleeve is a little bit different. Explain about that.
So gastric sleeve is a simpler procedure. It involves resecting approximately 75% of the stomach, the outer part of it, so that rather than having a bag-like stomach, you end up with a very narrow, slim, elongated stomach that is in the shape of a banana or a sleeve. So it's called gastric sleeve, or it's called vertical gastrectomy. Now, when you do that, you result with a smaller stomach, so your intakes are reduced, as well as also separating or removing the outer part of the stomach reduces significant amount of ghrelin or appetite hormone, so your appetite decreases as well. So the weight loss primarily is because of the reduction in portion size, and your portion size reduction can be achieved because your appetite is reduced, and so the weight loss is achieved. It is more of a recent procedure. It's been around for about maybe 10 years. We do have some 10-year outcome data is out now about this procedure, so that it does achieve very good outcome in terms of weight loss, in terms of achieving resolution of some of the comorbid conditions such as diabetes. It may not be as effective as gastric bypass, but achieving weight loss, it can be as effective. Now, the precautions about the gastric sleeve are that patients who have severe reflux may actually experience continued reflux, or maybe even a slight worsening of it in the long run in a small percentage of patients. So that is a precaution.
And what is life like after bariatric surgery for these patients, as far as going to restaurants and group support and supplementation? Do they have to take supplements? Speak a little bit about life after surgery.
So whether it's gastric bypass or gastric sleeve, patients who undergo bariatric surgery, they require to adapt same lifestyle changes in terms of modifying their diet. They have to certainly, along with the reduction in their portion sizes, they have to actually exclude certain type of food from their diet. In my opinion, patients who are morbidly obese, they have difficulty controlling some sugar intakes, and certain food can trigger their hunger and cravings long after the surgery is done, so that their same behaviors that existed can return. Therefore, certain snacks and soda and sweets need to be avoided after surgery. However, aside from that, their food intake, as far as the variety of food that they can have, is not much change in terms of the fruits and vegetables, the dairy products, the meat. These are slowly reintroduced to their diet, so eventually patients are able to have all these variety of food. However, certainly the portion sizes will be reduced for the rest of their life. Therefore, they have to adhere by paying attention to how much they intake. Now, when they go to restaurants, they can certainly order food off the menu. However, their portion size will be smaller, so usually they end up sharing a meal with their family or their partners. We do give small cards that they can present to their restaurant. Sometimes the restaurants do honor these cards so that they can order sometimes even off the kids menu. Both gastric bypass and gastric sleeve patients have to take supplements, multivitamin, vitamin B12, calcium, and sometimes in addition B complex or B1 and carotene, vitamin D. These supplements must be taken by both patients because it's really due to the reduction in the portion sizes rather than actually the malabsorption part that they require vitamins. Certainly for gastric sleeve patients, because we're removing part of the stomach, the B12 supplement is actually very essential.
And how much weight can someone expect to lose?
Well, it varies depending on how much weight they need to lose. Some patients are 100 pounds over their ideal body weight. Some patients are 200 pounds over ideal body weight. Both procedures we can expect to lose a significant amount of weight. However, in my experience, gastric sleeve, you can achieve up to about 100 to 120 pounds weight loss effectively. So if a patient needs to lose about 120 pounds of weight, they can expect to lose somewhere close to that amount, or 85 to 90% of it with a gastric sleeve. However, when you go over 120 pounds, then the effectiveness of gastric sleeve may be challenged, and losing beyond 150 pounds of weight loss may be difficult. In gastric bypass patients, the upper limit of weight loss can be extended up to 250 pounds of weight loss, so that in patients who are over 150 or 200 pounds of weight loss in terms of their weight, they may benefit from gastric bypass versus gastric sleeve.
In just the last few minutes, Doctor, what should people that are severely overweight think about when considering bariatric surgery?
Well, I think it's important that you have to think that you're doing this for your health, and that your health is what's important. Sometimes patients think about bariatric surgery because they've been diagnosed with hypertension or diabetes recently, or patients have been require joint replacement, such as knee or hip, and their surgeon requires them to have weight loss. Again, because of the criteria that exists, we certainly make sure that the patients who qualify surgery are patients who actually can certainly benefit greatly from the reduction in weight loss, but it's really more for the benefit of their achieving a healthier lifestyle. Now, aside from that, they need to remember that surgery in itself may result in weight loss initially, but after beyond a year to year and a half, not everyone keeps the weight off. So it does require a commitment to make lifestyle changes, and that is essential in achieving long-term weight loss. Otherwise, even gastric bypass or gastric sleeve may result in only temporary weight loss that may give you weight loss for a brief period of time, such as 2 to 5 years.
And why should they come to Southwest Healthcare System for their care?
Well, Southwest Healthcare System has been a center of excellence for bariatric surgery for the last over 11 years. That means that they have a track record in terms of overall quality of care that we've provided that's been overseen by the national entities. We've done over 7,500 procedures at Southwest Healthcare System. When patients ask me which or what are the safe bariatric procedures, whether it's gastric bypass or sleeve or any other procedure, usually my answer is a safe bariatric procedure is a bariatric procedure performed by an experienced bariatric surgeon in a experienced comprehensive center. When that's correctly, then we make sure that we provide safe and effective care. So I think Southwest Healthcare System has demonstrated to be such a center.
Thank you so much for being with us today. You're listening to Southwest Health Talk with Southwest Healthcare System, building relationships that touch the heart. For more information, you can go to swhealthcaresystem.com. That's swhealthcaresystem.com. Physicians are independent practitioners who are not employees or agents of Southwest Healthcare System. The hospital shall not be liable for actions or treatments provided by physicians. There are risks associated with any surgical procedure. Talk with your doctor about these risks to find out if bariatric surgery is right for you. This is Melanie Cole. Thanks so much for listening.